F.A.S.T. Fast. The warning signs to spot a stroke. Today, I want to talk to you about something that could literally save a life. Recognizing the early warning signs of a stroke. Stroke is a medical emergency, and every second counts. That's why we use the acronym F.A.S.T. A simple tool that helps anyone, anywhere, quickly identify the signs of stroke and act without hesitation. Let's dive in. What is the F.A.S.T test? F.A.S.T stands for face, arms, speech, and time. This test is the most common acronym to remember the most common signs of stroke. Important reminder. Timing is critical. Early diagnosis of stroke is important, because stroke patients are eligible for tissue plasminogen activator injections only if they arrive within 4 hours of stroke. Stroke patients may not be eligible for TPA injections if they don't arrive at the hospital in time. How to do the FAST test. If you think someone may be having a stroke, act fast and do the following test. F for face drooping. Let's start with test for face drooping. If you suspect a stroke, ask the person to smile. If one side of the face droops or looks uneven, it's a red flag. A for arm weakness. This can also be a leg weakness. Ask the person to raise both arms. If one arm drifts downward or feels numb or weak, then this could be a stroke symptom. S for speech difficulties. S is to test for speech. Is the person's speech slurred or hard to understand? Can they repeat a simple sentence? Trouble speaking or understanding is another strong warning sign. T for time to call emergency services. If you see any of these signs, call emergency medical services right away. It is also important to note the time at which the symptoms first started appearing. This information helps doctors determine the best treatment for the patient. Other signs of stroke. The FAS of F.A.S.T are the most common signs and symptoms of stroke. However, they are not the only signs of stroke. Other signs of stroke may occur alone or in combination. These are numbness, weakness or numbness or paralysis of the face, arm or leg, on either or both sides of the body. Confusion, difficulty speaking or understanding speech, trouble walking, dizziness, loss of balance or an unexplained fall can be a sign of stroke. Trouble seeing, loss of vision, sudden blurring, or decreased vision in one or both eyes. Severe headache. Headache, usually severe and abrupt onset, with no known cause. Difficulty swallowing. Call emergency services right away if you or someone else has any of these symptoms.